Hey everybody, it's Gypsy. Um, so I have been working on my physical therapy exercises at home, and as I said yesterday, I'm not using my brace anymore. Aside from the initial injury and the weeks following, or days after surgery, which in all my life, that was the most painful thing I have ever experienced. And I am even comparing this to natural childbirth. It was more painful than that. I don't ever want to experience a pain like that again. And it was just, wow. But anyways, the physical therapy and occupational therapy I had previously been doing was to strengthen my arms and my right leg to be more mobile, because my left leg is not weight bearing, so I needed to be strong in there. So that's what I had been working on, and that was easy enough for me. It wasn't painful. Could be exhausting at times, but it wasn't painful. But now I am at the point where it's time to bring back the flexibility and mobility in my left leg. The one that was, I fell on and shattered. And I have to say, aside from the beginning, this is the most painful part. Without my brace, and at home I use my walker. When I go out, I have to use a wheelchair for long distances. But just using my walker with my leg just dangling there without the brace, it really hurts. Okay. And I have been working on my exercises. I do them at least twice a day. And I'll tell you, it is painful. The most simple movements that I took for granted before I fell are just, some of them are still impossible. There are certain muscles in my legs that are just not working yet. I know they will. And the ones that are working again still hurt. It's wow, really painful. But I keep telling myself I have to work through the pain. Regardless of how painful it is, the only way I'm going to get use of my leg back and for it to work properly is for me to ignore I can't ignore it, but just work through it. I have to just keep doing these exercises and using my left leg within the parameters that my orthopedic doctor set, no matter how much it hurts. So this is a difficult part for me. And as I told you guys, my orthopedic doctor ordered outpatient physical therapy for me, which I'm hoping to start this week. The hospital they faxed over the orders from my doctor to the physical therapist place here in my neighborhood. And so I have to call them Monday to set my appointments. I have to say I'm afraid. I'm nervous because I know it's going to be rough. It is rough doing them at home. It is rough just getting around the house. It is painful. My leg has been on a commission, and I still have the pain from the injury and the surgery and stuff. But then just trying to get the muscles and tendons to work and the joint to move as it's supposed to. Wow. And you want to talk about creptitis. My knee, when I work my knee, or sometimes just when I'm using my walker, I've had creptitis before, but this is like really loud. I mean, it's not mouths, but I just keep telling myself, okay, with every crack, I'm getting more mobility back. Now, I have not seen this totally to be true, but this is what I'm telling myself. So if any of you are dealing with this injury and the physical therapy, or something else where you have to relearn how to use a limb, I know it hurts. It's really bad, but you just got to keep working through it. Already, I have seen improvements. Now, my flex in my knee doesn't want to go beyond what I showed you the other day. For the first week, I was making progress, and now it's stuck at that one point, but I just have to keep doing it. I did show you guys, all right, like moving my left leg out, coming back in. It wouldn't move on its own. It just wouldn't do it. I had to use my hands to get it back in. Well, today, it came back in, and when I do bring it out, it's at its full range of motion now. It's the full range of motion, but it hurts like hell, but I can get it to come back in. What I can't do is lift my leg. It's still like my leg is dead there. So I use my hands just to give that muscle and tendons motion until they get stronger and loosen up, so that I'm sure soon I'll be able to lift it. One of the things the therapists are always wanting me to do is to flex my thigh muscle. And I said, when I would do it, I would tell them, well, I can't tell if it's moving. I can't feel if it's moving. So they always had their hand on my thigh, and they would let me know if it's moving or not. Most of the time it was moving, and I just couldn't feel it. But sometimes, like, I'll do a few, and then I can't get it to go anymore. So that's still what I'm dealing with there. But it all hurts really bad. And I know with me being in a rehab hospital and then in a skilled nursing facility, what I noticed with other patients is if it would hurt, they would just want to stop, or sometimes they just wouldn't come to their physical therapy appointment because they didn't want to deal with the pain. Mine was the opposite attitude, to the point they had to rein me in a little bit, where it was like, Michelle, if it's too much and it's hurting too much, don't do it. Don't go beyond where you are now. But me, I just want my life back. I want to walk again so badly that I'm pushing myself too much. They did say at some point, all right, like when I was strengthening my arms, I have cervical radiculopathy. So she had me working with weights. Well, there were certain movements I couldn't do. And I was trying to force myself to do it, and I was getting angry. And she was like, whoa, what's the problem? And I told her about that. And I said, it's not letting me do this exercise you told me to do. She says, then don't do it. Do your left arm. Or she did like a modification. So that's where I go too much. I don't try to, like, all right, if I'm doing my knee flexes, it's painful, yes. I only do it until my knee won't bend anymore, which is not very far. I wish it was further. I won't force my knee past, but I just know if I keep doing that, eventually it's just going to go, it's going to start moving more and more. My thing is I want to bend it enough so I can drive. Now, my problem is if I start driving before I have weight bearing in my left leg, how do I get my wheelchair or my walker out of the truck? I have a pickup truck, so it is high up. That's a major feat, getting in and out of the truck, because I have to hop up into the truck on one leg backwards. So I have to think about that now. Hopefully, if all goes well, I only have a month of being non-weight bearing. So it's not too much of an issue for me anymore. It was before, when I knew I had a long time, and they had to tell me, you are not going to be driving. Get that out of your head. So that's where I am right now. Right now, we're trying to set up things so that I can get in and out of the house all by myself. As you guys know, I love being outside. Well, spring is coming, and we've been having storms today, but it's getting to the point where I'm going to want to be outside. And then, we have a transit system in this county that will come to your house and pick you up. I just have to be able to get out the door myself. So this way, I could go to my doctor's appointment. My primary care doctor is right here around the corner. I could get to my physical therapy by myself. My mother's in the nursing home just around the corner. I could go see her whenever I want. So we're trying to fix it so I can get in and out of the house by myself in my wheelchair. So I could take the public transportation, or if my friend comes pick me up, we didn't want her having to struggle to get me in and out. So we are working on that. But anyways, my main point here was if you have a serious traumatic injury like this and you're doing physical therapy, try to work through the pain, but also listen to your therapist. Don't be like me and try to push it. I think maybe I'm a little bit too anxious to get better. But do know it's going to hurt. You know, before I thought, oh, physical therapy is easy. Well, I was just working my arms and my right leg. Well, now that I am working the left leg to bring back flexibility and, well, mobility eventually, this is the really hard part. Because I would hear people say, oh, physical therapy, it hurts. Oh, my God. And I was doing it. No, it doesn't. Well, now that I'm working on the damaged leg, it does. Now, I have gone for physical therapy in the past for the same leg, but it was for my hip, which that injury was a birth defect. So that was like when I was a baby. And I have had to go for physical therapy for that because it is weaker and causes me pain. And that wasn't even that bad. It would hurt, but nothing like this injury. I think when you have a traumatic injury like that, very sudden, it's even harder. Okay, so just work through it. So I'm going to leave you with that. Blessed be, and make it a joyful one.